And so then I was gonna say, right? So how does the social determinant of health affect cancer and cancer disparities and cancer outcomes?
Yeah, absolutely. I mean, when you think about cancers like colorectal cancer, even research that we've done on breast cancer, we understand that eating well, having a healthy lifestyle is going to be important from the standpoint of prevention. So, these social drivers aren't only connected to things that we commonly talk about, which is, for example, things like cardiometabolic disease, diabetes, which people can make a very clear connection, right? Not eating right, diabetes, high blood pressure, not eating right, not being able to exercise, being overweight, high blood pressure. But they also connect to cancer. They absolutely connect to cancer. So you have the social drivers impacting these cancer disparities. You also have some of the access issues, having lower levels of insurance that then limit your ability to get a mammogram, a GYN exam, and pap smear to prevent cervical cancer. Blood tests and a digital rectal exam to prevent and identify prostate cancer. We now have technologies, high resolution CT scans that allow us to detect lung cancer in smokers at very early rates. All these things become unavailable to large populations. And so not only are they not able to do the things that focus on prevention, but then when we think about the common things that are recommended for everyone around screening, they're less accessible and less available. And I would further add that even when you have insurance, oftentimes not all insurance is alike, and some of these technologies diffuse years later into communities of color, further contributing to these disparities. So it's a series of steps here, but we need to account for all of them, and we need to address all of them. We can't just address one or two along that continuum.